Bismillahirrahmanirrahim. Assalamu alaikum. So today we are going to study about the one of the most important topic in the vascular pathology, and that is called the vascular tumors. So what are vascular tumors? These are the tumors of the blood vessels. Tumors of the blood vessels. The vascular tumors are classified into three types: the benign neoplasms or the tumor-like lesions. They constitute the one group. The intermediate grade neoplasm and the malignant neoplasm. Benign, intermediate, and the malignant neoplasm. So this is the picture taken from the Robin pathology, and this classification we have divided the tumors into two groups, as we already discussed: the benign, which include the hemangioma, lymphangioma, the glomus tumor or the glomangioma, the vascular ectasiasis. Although this is not a benign tumor, but it is a benign tumor-like lesion. And the third one is the fifth one is the reactive vascular proliferation, which is in the form of the bacillary angiomatosis. It is also not a true tumor. The second one is the intermediate grade neoplasm, which include the Kaposi sarcoma and the hemangioendothelioma. And the third one includes the malignant neoplasm like the angiosarcoma. First, talking about the hemangioma. So the hemangioma is derived from two words. The hem means the blood, and angioma means the vessels, blood vessels. So these are the most common form of benign tumors of the blood vessels. The most common benign tumors of the blood vessels, and it constitutes about the 7% of the benign tumors of infants and the children. About 7%. So look at the picture. But the important point and the good point that they regress spontaneously with time. Most of them regress spontaneously with time, and the malignant transformation of the benign tumors into malignant tumors is very rare. Very rare. So talking about the common sites. So the common site, which consists of hemangioma or the head and neck region, and also the visceral organs like the most important one is the liver, others organ are kidney, etc. There are about 4 variants of the hemangioma. The first one is the capillary hemangioma, which is the benign tumor of the capillaries hemangioma. The second one is the juvenile mean infants. The third one is the pyogenic hemangioma, and the fourth one is the cavernous hemangioma. First, about talking about the capillary hemangioma. So this variant is the most common. It is the most common type, and it mostly involves the skin, subcutaneous tissues, and the mucosa of lips and oral cavity. The skin, the subcutaneous tissue, and the mucosa of lips and the oral cavity. These are the 3 organs which are mostly involved, and it can also involve the internal organs like liver, kidney, etc. And if we see the cavernous hemangioma, so morphologically or histopathology, in histopathology we can see in the capillary hemangioma that it consists of thin-walled capillaries with a scant stroma. Thin-walled capillaries, many capillaries, if we say thin-walled, many capillaries with a very scant or very little stroma. So this is the histological picture of capillary hemangioma. You can see this is a normal liver. This is normal parenchyma of liver. Here you can see a lot of capillaries lined by the endothelial cells and a very little fibrous stroma. As we have discussed already. Here you can see the capillary hemangioma. This is the capillary hemangioma on the mucosa of tongue. Coming towards the second type, which is called the juvenile hemangioma. It is also called as the strawberry or the infantile hemangioma because it is extremely common in the infants, and about 1 out of 200 consist of juvenile hemangioma. But the good point is that most of them regress spontaneous by about the 7 years. You can see the juvenile capillary hemangioma. This is the hierarchical picture consistence of a lot of capillaries and a very scant stroma between them, same as the capillary hemangioma. The third one is the pyogenic hemangioma. So pyogenic hemangioma is characterized by the rapidly growing, I've changed the color, rapidly growing, these are the important points. The first one, it is rapidly growing, it is red, it is stalked lesion and present on the skin, gingiva and the oral mucosa. It is rapidly growing, it is red, it is stalked, means that it is hanging by a stalk, as we can see. This is the narrow stalk or neck, this is the skin, and this is the pyogenic hemangioma, consists of neutrophils. You can also see this is the pyogenic hemangioma. Histopathology, they resemble the abundant granulation tissue. And the other important point that they bleed and ulcerate very easily. So they bleed and ulcerate very easily. And if this pyogenic granuloma occurs in the gingiva of pregnant woman, then it is called pregnancy tumor or granuloma gravidarum. Pregnancy tumor or granuloma gravidarum. The fourth one is the cavernous hemangioma, is composed of large dilated vascular channels separated by connective tissue stroma, and it mostly involves the deep structures. And the other most important point is that they don't regress spontaneously in contrast to the other hemangiomas. They don't regress, and it is very infiltrative in contrast to the other hemangioma. These are some of the distinguishing features, and they are mostly present in the deeply, they don't regress spontaneously, and they are very infiltrative. And it involves the main organs, they are locally destructive, like if it involves the brain, then it can lead to the features or symptoms like seizures, headache, confusion, etc. And the treatment that it requires surgical excision. And the other important point that it can ulcerate and bleed very easily, same as the pyogenic hemangioma. This is the pyogenic hemangioma on the tongue.